again, I know there was some other questions earlier on that we didn't get to, or other points of discussion that people would like to bring up around this for our three extraordinary presenters.
I actually have a question, if no one has a question.
Okay.
For those of you who in the audience who work in other countries, I would love to know what the political climate is in those countries. Are they supportive of family planning, government and churches in those countries? I would be curious to know if you're willing to share. So.
I'm not in a developing country, I'm in the UK, but it's a really positive message on family planning.
From the government.
And there is a very positive, we have one of the highest rates of teenage pregnancies I think it's the highest in Europe. And so there is a real push to try and prevent that. And there has been a big push on long-acting reversible contraceptives as well. But any contraceptive goes, basically.
And that you were gracious to say that you have the highest in Europe, because in the world, the U.S. is by far the leader in teenage unintended pregnancies. Henry.
Henry Mosley. You know, a lot of you in developing countries understand the situation about logistics and supplies. And I want to make an appeal right here about the standard days method, because I think it's a great method. But I'm concerned about the fact that the cycle beads can only be one way. I was involved in the development of oral rehydration therapy in Bangladesh. And once we worked out the formula, the World Health Organization says it must be in a 1 liter packet and it must be chemically pure salt and sugar. Otherwise, you won't get the effect. Well, we realized in Bangladesh where we were working that this was not going to be accessible. And so we taught them Laban Gur. Gur is a sugar, and it was a 4-finger scoop of sugar and a 3-finger pinch of salt. I remember in Nepal, for example, they didn't have a 1 liter container. They used a beer bottle, which was 800 milliliters. And so, if you standardize the 1 liter package, then it wouldn't be appropriate for the containers they had. And so, what we say is we have a technology, and I'm saying I would hope that somewhere down the line, the Institute would say different ways different countries can do it themselves. I love this idea of boxes and rocks and pebbles. I mean, and other kinds of things like this, so that the technology, because the real thing is learning that there is a cycle, and that there are safe periods and unsafe periods. And I think that is something that every man and woman should know. But don't get bound up by saying, oh, well, it must be a particular technology that happens to only be manufactured in the United States or something. Or maybe if you do want to have it manufactured in one country, get the Chinese to manufacture it. Then it'll be 1 cent, 1 cent a piece or something like that. But I just make an appeal that, getting that knowledge out is so crucial that we shouldn't be bound up by saying it's going to have to be done this way, otherwise it won't be quite as efficient. Laban Gur wasn't quite that efficient, but it did save most of the lives.
Can I just set the record straight? Actually, cycle beads are not at all manufactured in the US. They're manufactured in Hong Kong, so already using that, and then Peru. But a really good success story is that we have partnered with a local manufacturer in India, HLL, who will now start to produce cycle beads. And we are absolutely looking into local production. This is such an issue in terms of availability, but there are such huge startup costs. I mean, there's so many business implications for starting up a factory and teaching people how to manufacture them in the right way that, I mean, we really are for this, but IRH isn't funded to sort of understand and pursue all those business issues. So if you know of any businesses who are interested and want to take this on, we appreciate that. And I also want to note that we've developed an mHealth application called CycleTel, which uses text messaging to communicate the standard days method so that the woman doesn't have to use the beads. And this is, again, much more quick and interactive and gets out to women in the most rural areas, but it has so many business implications that we really need those social entrepreneurs to partner with us to get it out there.
is CycleTel an app that will tell each individual cell phone owner what their own cycle is?
Yes, absolutely.
So it doesn't
for-
require any depletion of their credits on their cell phone. Nobody's going to call them.
Well, that's just it. We need to partner with mobile technologies like Safaricom in Kenya or Digicel, and so that they can subsidize this, because there are definitely cost implications that go along with it.
With the app.
Yes. So for smartphones, there's an application called iCycleBeads that you can download for $2.99.
Yeah, but
If you-
nobody has cycle phones. Everyone in Bujumbura has cell phones.
Exactly. And so that's accessible to anyone who has smartphones, but there's also CycleTel, which is based on SMS, which is accessible to almost anyone in any rural
No
area.
one in the rural Burundi has cell phones. It's really remarkable. Wanted to ask about youth associations in various countries and what they're doing.
Youth associations in various countries that. There was a presentation yesterday about some of the materials that IRH is using now, but I don't know if there's others that are want to comment to that. That's not exactly part of this presentation, but if somebody wants to comment on youth associations, youth. Okay. Okay, others, comments, thoughts? Yes.
Hi, I'm Katie Kraft. I'm with United Methodist Church, and I work with Mona on a lot of policy and advocacy, but it's been great to hear about sort of the supply chain and sort of the method mix, which is great. I support, a huge method mix, a variety of methods, but I think what we're not addressing when talking about cycle beads is that it really, thank you so much. It depends on a woman's power and agency within her own relationship to be able to determine when she has sex and when she doesn't. And so I'm wondering, for folks that are working with cycle beads, how do you sort of reconcile putting resources and training into using the method that we know in parts of the world women don't have that power and agency sometimes?
Yeah, no, I think that's a really good question. And I think what IRH is trying to advocate is that we really want women to have a wide choice of options available to them when they come to the health center. So it's not that we're saying cycle beads is better than any other method, because those same issues have to do with pills and with condoms, the negotiations between men and women to be able to use things correctly. A lot of the user-directed methods just happen to have that characteristic that goes along with them. So if a woman is in a situation where she needs to use family planning and clandestine family planning, then that is her choice, and she should opt for injectable or another method. But I think one thing to note is that some men are just ignorant or unaware, and those conversations are very hard to have. But using cycle beads, which is to have the visual there, it initiates the discussion that had never taken place. And once you have that conversation, I think there are some situations where you can move forward and start discussing that and agree to use a family planning method within the couple unit.
Yeah, and
I think you should send the text messages to the men.
They're able to sign up for it, yeah.
That's great. Just coming back to rural Malawi for a moment, and having the privilege of doing some village-based evaluation for USAID, and including cycle beads that was being introduced by a secular organization, Management Sciences for Health, and talking with the catechists who are trained to educate their own members of their parishes, and seeing how they really catch fire with this. A husband and wife, who's teaching others and going around not only to their own church, but then to all the other churches around with great enthusiasm. I mean, so there's many dimensions to this, and of course it's not perfect and it's not for everybody, but boy, when you don't have anything, it's a great place to start, and it's a great way to educate everyone on the fertile period. So I mean, there's many dimensions and layers to this. In addition to having a husband and wife talking with congregation where there's men and women, and educating couples at their doorstep too about cycle beads. So it's fun to see it when it works, and it does.
Oh, okay.
Oh, I'm sorry.
Yeah.
Excuse me.
Pastor Bobo from Liberia. the family planning in Liberia, the difficulties, if you train only the women and leave the men out, it cannot be effective. So they find it difficult. Women go to the health center, like the sago beans you're talking about. She will be well trained how to use the sago bean. But if the husband is not aware, it can be effective. So for me, to the church, I teach couple, husband and wife, how to space the children. Because if you have more children in Africa, you will not be able to take care of them adequately. You will not be able to educate them. The responsibility of educating them will be too high. So for me, in the church, I like to talk to both husband and wife. Tell the man the importance of spacing children. And tell the man the importance of the family planning. What will make it effective? How important it is. If you have less number of children, they can go to good school. If you have 5, 10 children, they won't go to good school. You will not prepare them, and children are our future leaders. So we need to give them better education, prepare them for the future. As we are passing out, they are our heritage. They will take over when we leave, when we shall have gone. So if we don't give them quality education, then we'll have no future. And then when they started with the family planning, the health center in Liberia were involved, everybody. But the problem they had was that they were leaving the husbands out. And so every time somebody text to the men, it's very important for both the wife and the husband to be fully aware. That's the only way it will be effective. If the woman using the sago beans and she knows how to use it very well, she's aware, but the time she will be her ovulation period, her fertile period. If the husband is not aware, the man will come into midlife. So how effective will it be if the husband is not trained? So I'm thinking of when I go back or communicate with you, we write a project and then try to do what we can help. For my community, I pastor a church in a very big community, populated community. And so I'm so much blessed for this conference that when I go back home, I'm trying to write a project to create awareness in the community, and I'm able to talk to both husbands and wife. In Liberia, the children, the population is so high. People don't know how to control. Birth control is no more. The child is sitting down, and then the woman is pregnant. So to how the children are no way, the children are not space. You can't tell the older from the younger. If you go in the interior, where I come from, I'm from Lofa. In the interior is west. The woman gets pregnant, but the moment she delivers before 5 months, and then she is pregnant again. And so we find it difficult there in Liberia, to be frank. At this conference, we're going to help us as we are getting in contact, connected. We'll write some project and we'll keep communicating with you. For your own advice, what can we do to reduce that, to create awareness in Liberia? And so as a pastor, we are going to do our best to see how we can help our people with what we are learning here. God bless you. Thank you. I'm Pastor Boyd.
God bless you. Yes, thank you. And you know, I'd just like to we've got a little time, just to give a plug for Mona's sessions tomorrow. Those people who know how to go to the Hill and talk with our congresspersons and their staff say it's a lot better than when people who look like me from America, go to talk with our congressperson, to have people from other countries who are living the experience go along. And so this, as I was complimenting the person from Senator Lugar's office, it really is kind of delightful for people who've never been to Capitol Hill to actually march up there and walk into the office and be heard and listened to actually more carefully than they would listen to me or even Ray.